Hello, I'm David Middleton, part of a father and son team, Middleton Healthcare Advisors. I'm the older one with the gray hair, in case you wanted to know. Questions, questions, questions. There's no end to questions, and nowhere is that more true than with Medicare. This is the first in a series that we've done on Mastering Medicare, where we're going to share a simple 10-step blueprint with you to take you from being confused and clueless all the way to clear and confident. How nice would that be? If you've ever dabbled in Medicare at all, you know that would be wonderful. Well, that's where we're going with this. So let's get started. All right, step one is to decide when you want to start on Medicare. And you have two options, either at 65 or at retirement and or a loss of group health insurance. And we're going to unpack those two as we go forward. But I first want to raise the question, that is, what does Medicare consist of? Well, it consists of Part A and Part B. And we're going to break those down here. Let's look at Part A, which is your hospital insurance. We're going to look at what it covers and what it costs. First of all, what it covers is inpatient hospital care, skilled nursing care, and some home health care and hospice. What it covers, man, it must be a lot, because look at that dude right there. He looks upset. I'd hate to be handing him that bill. Monthly premium for Part A is zero. Deductible is $1,632, whether you're in there one night or 60 nights. Okay. Then you got daily co-insurance for days 61 through 90 of $400, $800 lifetime reserve, and skilled nursing facility co-insurance is $200 a day, days 21 through 100. Now, what Part B medical covers is doctor visits, outpatient services, lab and x-ray services, DME, durable medical equipment and supplies, and a host of preventive services. And what Part B costs, there's a monthly premium of $174.70 and an annual deductible of $240. That's for 2024 here. You've got Part B co-insurance of 20% of the Medicare approved amount. You could have a 15% excess charge, and there's no cap on out-of-pocket spending, which is not a good thing. All right. Some additional notes on Part A is most people are entitled to it, having worked at least 10 years or 40 quarters. And for most people, it's premium free, having paid into the FICA taxes through their working years. Part B, additional notes, you can delay it without penalty if you're still working and have group health insurance. And most people pay that standard monthly premium that I've already mentioned, although it could be higher based on your income. Okay, going back to step one of when should you start on Medicare, at either 65 or at retirement. Let's look first at option one, at 65. This is during your initial enrollment period, or IEP. This is a 7-month window that begins 3 months before the month you turn 65, includes your birth month, and ends 3 months after the month you turn 65. If your birthday is October 27th, your Medicare is going to start on October 1st. You go back 3 months to the 1st of July. You go 3 months beyond October to the end of January. There's your 7-month window there. And if you don't enroll during this period, you may have to pay Part B and Part D late enrollment penalties. But a note is here, your Medicare is always going to begin the first day of the month you turn 65, although it's not always, because if your birthday is the first day of the month, your Medicare is going to bump to the first day of the previous month. There's your first exception. Okay. Another thing about if your option at 65, if you're drawing Social Security, that is you're retired or you have no health insurance, you're going to automatically be enrolled into Medicare. You'll receive that Medicare card about 3.5 months prior to the first day of your 65th birthday month. And the Part B premium will start being deducted from your Social Security check in your 65th birthday month, or perhaps the month before. But if you're not already drawing Social Security and perhaps still working with no or bad health insurance, you're not automatically going to be enrolled in Medicare. You must manually be enrolled through Social Security, and you'll receive a quarterly bill in the mail to pay that Part B premium times 3 months is going to be $524. Option two is starting Medicare at retirement and or a loss of group health insurance. This is during your special enrollment period, or SEP, an 8-month window you have to sign up after your employment ends or your group health insurance ends, whichever happens first. And this is when you plan on retiring and or be losing your group health insurance. Or if your group health insurance changes and you decide you want to start on Medicare, you can always compare the two and see which one ends up being better for you. You must manually enroll via Social Security. That is, start your Medicare Part B. And it's helpful to start this process about 60 to 90 days before you want your Medicare to begin. At retirement, you must provide proof of employment all the way back to 65 with no missing months, and proof of creditable health insurance coverage. And most group health insurance is considered creditable. Also, some helpful forms on the L564 to give to your HR department for them to give proof of employment, and the CMS 40B that tells Medicare what month you wish to start your Part B. Okay, so a summary of step one. When should you start on Medicare? If you're starting at 65 during that IEP and you're drawing Social Security, you're going to automatically be enrolled in Medicare. You don't have to do anything. You'll get that red, white, and blue card. If you're not already drawing Social Security, you're going to have to manually enroll. And then if you start your Medicare at retirement and or a loss of group health insurance, the focus is on starting Medicare Part B. The effective date should be the first day following the end of group health insurance, and you must manually enroll again via Social Security. The ideal method is to enroll online. Well, there you have it, folks. Step one of decide when to start on Medicare. We want to thank you for joining us here. Hope this was helpful. If you have any questions, you can either go to our website at middletonhealthcareadvisors.com, or you can call us at the 800 number there, 888-322-8922. Either way, love to hear from you. Hope this was helpful to you. Take care. Godspeed.